Hello friends. Today we are going to learn about the second chapter of Civics, that is role of the government in health. Here we are covering the concept of health and its various aspects. In our country there are public and private healthcare facilities. We learn about this through the short story of cost of care. We will see the differences, how it works, and how government and our own money is involved in all this. Then we are discussing what can be done in the light of couple of examples. So let's deep dive into this. But before that, please like, share, and subscribe to this channel and watch the video till the end, as it's not going to be so long. Now, there are some pictures in your book at the beginning of the chapter. Those indicate crunch of water, undernourished people, lack of sanitation, etc. These pictures give us the sense that health means not only a body free of illness and injuries, but it is a much wider concept with the aspects like adequate food, pollution-free environment, clean clean drinking water, healthy, fear-free mind, comfortable living conditions, etc. Now let's think about the healthcare in India. Please take a careful look at the charts and diagrams in every slide, as it will clear your understanding in a glance and you will learn this concept in a more organized manner. When we look at these pros and cons, we get amused, as this is pure irony, where pros states largest medical colleges, plenty of doctors pass out each year, the increasing number of government hospitals, and large number of medical tourists, where as our rural population is living in the lack of all these facilities, the diseases like TB and malaria are still affecting us like before due to the lack of sanitation, clean drinking water, and adequate food. When we read both these columns, we cannot believe that we do not have enough funds to manage our healthcare. What we lack is rather proper planning and vigilant execution of our planned things. Actually, the previous slide itself gives us the idea that there are two different Indias dwell inside this one country, rural and urban, and rich and poor. Public healthcare facilities are provided by government to the people in less cost or no cost at all. Now you might think about money. From where government got this much money for all these? Actually, it's through the taxes that we pay as the citizens of this country to the government regularly. Ask your parents about how and when they pay the tax to this government. Is only providing low cost medical facilities is the work of government? No. Rather, its work is to prevent the spread of diseases like TB, malaria, jaundice, cholera, etc. For that, government needs to work on the basic requirements of healthy living. Many villages are covered through the primary health centers in rural areas, and district hospitals serve in urban areas, and also they supervise the PHCs in rural areas. On the contrary, the private healthcare facilities are completely owned by the doctors themselves. In rural areas, we find registered medical practitioner, and in cities, many doctors run their private clinics. These private facilities are quicker, more efficient, but they are more expensive to afford also. So these private healthcare facilities cannot be afforded by everyone, especially the poor people. These conditions really indicate two different worlds in a single country. So, now if we think about the equality that we have learned before this chapter in our civics book, do we find that equality while thinking about healthcare in our own country? No. We just see the differences like rural, urban, rich, poor, and the poverty is the main reason behind this. Due to the poverty, people are unable to avail good health and healthcare facilities. it has become a vicious cycle, as where poor people are prone to more illness due to the undernourished conditions and poverty. The pictures in the beginning of the chapter indicate the same. And the poverty or less or lack of money makes it even worse because they don't have enough money for treatment, so their health gets worse. After looking at all these points, at the end we just think, what can be done, how we can improve these conditions. So let's look at these two examples. Uh, One is in our own country, the state Kerala experience, and the one is from Costa Rica. So, the 2 points here: provide proper basic amenities and improve social conditions of people is the one where in 1996 Kerala government tried to go to the route to give the amenities to the rural people. For that, they have given 40% of their budget to the panchayats, and it really helped in planning and providing basic amenities. While in Costa Rica, what they have done, they cancelled their army. They cancel the fund of their army, they cut off the army, and what they do with that money, they use that money for the basic needs of people. Means they have worked on the wider concept of health. They provide the comfortable living conditions, clean drinking water to their people, and it worked well. So now Costa Rica is considered one of the healthiest countries in Central America. I hope you understand these concepts properly. Now go through the question answers carefully. Thank you.